I
Oh,
live
yes,
in one of those high-risk areas in Leeds 8, and it was really nice to see people knocking on my door, saying good best. And I did go to the Bilal Mosque and talk to Tina from Public Health, who was coordinating it. And it was really good. It was good to see people out and about. And the results were quicker than I thought. The following day, even though it was 48 hours, and I was pleased to know that I didn't get the variant disease. So I was jumping up in joy for that. And I think for everyone, it just reconfirms that I'm all right. We've got so many anxieties going on at the moment and forgetfulness for me at the moment, that it's nice to know that if you're shielding and you're looking after anybody with care needs, that you're clear, because then there's a responsibility on us to share. We're all right, don't worry about us if we come to your house. So it was really nice to see, 2 people on the door. And I think, that's really helpful. So I just wanted to share that with you. So it's not scary, guys. It's not an injection.
Thanks, Jag. Owen?
No, I was just picking up on the mobile vaccination buzz. I guess, like, from discussions earlier in another kind of autism provider forum, talking about those people who find it really hard to access their GP, and whether or not, just as a note for forward discussions in the future, that there will be lots of people who aren't leaving their house or would find it really difficult for various reasons to attend a vaccination site or their GP, and whether or not there's an option for those people going forward. I know you said it's a pilot, so it's kind of early days, but just we suspect there's a significant amount of people who would need a home visit of some sort, or to at least be local to them in some way.
Yeah. I mean, from what I understand is that there will be 4 buses. Over time, 2 of them will be information buses, especially if people have got those questions. Again, it will be local within their communities. And then after the first pilot of the first bus, the second bus will then be deployed. And I think you're right, Owen, there's lots of people that have not left the home in, almost a year. To then say to these people, we want you to travel either to your GP or to a vaccination or testing site, recognizing that it can be quite scary, and the anxieties that people have. So yes, I would imagine that over the next few weeks, because we are getting through the priority list really well, and the next age groups, that is something that is on their radar.
Cool.
Yeah. Jag, did you have it? Yeah.
Just to say, I know you mentioned the bus idea, but that's been a long time idea. When I was at youth work, why is it taking a year and plus? It just worries me. I remember the red bus that stood outside the town hall many years ago, and it was, you come in and you share with libraries and stuff. Have we lost the expertise? That's what concerns me. It's common sense, isn't it? We go to communities because they don't want to come out. Just echoing Owen's point. And it's a year on. So, just a bit of frustration, as well as me being optimistic. Got up the game. People aren't going to come. And we know health inequalities are massive. We know we should be taking a bus down to Middleton. We know where to go. Let's not pretend. It's not rocket science what we're suggesting, but we should have got on with it earlier. It's a big frustration for me that people don't listen. It was October, I think I mentioned, that we need a BAME strategy. We need to target proactively a campaign. And I give up after a few attempts at it. It's common sense. I'm not particularly bright, but we knew in September, we knew earlier BME people aren't going to come forward. How do we do something creatively? What do? We go back to normal. It's really frustrating. So just to share, if we can push a bit harder and say, no, this is what we want. We don't want one-off sessions. We do want round the clock. We should have 5 till 7 sessions. We should have 7 till 9 sessions for working people. We should be looking at 3 to 5 outside school stops when people come out of schools with mothers and whatever. I've done all that. We just need to calm down and think differently. Here's my ask of everyone. If we can push them ideas across. Supermarkets, it's not hard to get to supermarkets. Why haven't we got a bus out there already? I
Yeah.
just don't get it.
Yeah. Simon, did you want to come in?
I think Emily had her hand up first.
Oh, sorry, Emily.
That's all right.
Simon, that was really kind of you. I just really want to reiterate really what Jag said. I used to work for Basis, and we did loads of health stuff on outreach. So literally on the street of Holbeck or in brothels around the city, doing things like vaccinations, Hep B vaccinations. It can be done, and that kind of stuff has been put in place previously to all of this. I am just personally applying to be a volunteer vaccinator. I've got my training on Saturday, and then I'll be good to go after that. And I'm really keen to look at, with these huge numbers of volunteer vaccinators, I know about it because I'm in the process of applying, and I'm one of the last, and there's oodles of us. And with the experiences like that I've got, once I'm qualified to actually give vaccinations, why can't I be doing that to particular groups in an outreach setting with a qualified sort of nurse who is overseeing it, of course. But it just seems to me that there are quite a lot of things in place already to be giving vaccinations on outreach. I know from sort of contacts I have from my previous job, so sex workers, that they're saying, why aren't we being vaccinated? We have really complex sort of needs, and we're in a very, dangerous job as well, of course, in terms of COVID transmission and things like that. So, I mean, that's the one example I can talk about, but of course you've got all sorts of different groups which we can all relate to for different but similar reasons. I really do think that we can do better. We're doing amazing. Like you said, the vaccination numbers are amazing, but we can do better by going out there and getting all those people that aren't going to fit into traveling to sites.
Mm-hmm. Yeah, good point. Simon?
Yeah, just a couple of points. I mean, firstly, it's absolutely fantastic that the new centre was opened at the Bilal Centre, because I think that's something which has been mentioned both locally and nationally about the advantages of having a faith building as a vaccination centre in order to encourage communities to have the vaccine, because obviously it's a trusted and familiar location. The other thing I would say, just in terms of the direction we're going in as a city and the rate dropping, I think it's fantastic, and I'm just hoping that when the government review progress at each stage, each stage of the roadmap, they do take into account local variations, because it would be a real shame if Leeds, for example, is penalised for a high rate elsewhere. I don't know whether that's going to be the case, but I think we should. But if we're doing everything right in the city, then and we're heading in the right direction, then it doesn't seem fair if the government pull back on some of their roadmap.
Yeah, I think it's I think it's just going to be an England roadmap from what I understand, and I think there has been disappointment that we won't possibly go into the tiers like we did before. And I mean, even before all this, where I live, I was in a tier 2. So our pubs, our Indian restaurants, our Chineses were all open, and everyone from tier 3, which is just a quarter of a mile down the road, were all coming into the tier 2 to our restaurants and our pubs and things. And I suppose it's how we combat that if we do go into tiers. So yeah, Sophie.
Yeah, I just wanted to say that it kind of just echoes what Simon's just said. The PCNs, I think, are looking for more community venues, because we were approached by itself by Beeson and Middleton to be a community vaccination hub, but we just couldn't accommodate it. So I think they are definitely looking at moving things more in community-facing venues. It's just a long thing, I guess, isn't it?
It's interesting you mentioned that, Sophie, because I mean, we're going a couple of months back, but I raised this question about a synagogue being used, and the response I got, I think it was somebody from the clinical commissioning group, is that there wasn't necessarily the demand, although I appreciate we are a few months on, and as more and more groups are eligible, that might change.
I think it takes a while, doesn't it, for information that we hear on to get to the point where it's decision making and then come back down, doesn't it? I think that's an age-old problem.
Right.
Can I just
So-
come in on that point?
Yes, sorry, Jag.
I think it's a really interesting point. I like to watch Newsnight once in a while, and this point was made yesterday about how we tend to not do it because there's not the demand. And I've had a couple of conversations about numbers of people and where they are and deprivation and all the rest of it. I think we should push back and say, just because it's not been done, as one doctor was talking from Sheffield last night on Newsnight, very interesting point you made. And the public health director stood on the street and he says, I could have told you this street is going to be disproportionately impacted on COVID. And the point I'm making is, just because we haven't doesn't mean PCNs don't do. And it's another example of doing the same old stuff by the same old people. And I'd really challenge it back, Simon, and say, not good enough. And, you know, we've got a community forum meeting next week. I'd urge you all to come to that, 16th of March, and I'll post you the details of it. But, you know, we're pushing back. We've pushed back as a third sector. We're doing some great stuff with the council around social care, how people from BME communities are coming to social care's front door. You know, we must push back, and it's just not acceptable. You know, we all as a third sector have to work differently, don't we? Every day we get up, we think, what can we do different? And it's no good just doing the same old, same old. It's not good for our own personal development. I feel refreshed when I see you guys. I know I'm under pressure. I've got to talk to somebody at 3 o'clock in between that. I know I've got emails to do. It's refreshing. So we must push back, or the PCNs are going to be the same old lethargic old beast made of the same people going the same direction of travel, and people are getting left behind. Sex workers, common sense says give them a bit more time and care and attention, and other vulnerable group. It wasn't rocket science around autism. It's not rocket science around disability in children.
Just to let you know, Jag, so we've had a few GPs and doctors come forward and say, you know, what is happening, you know, how is third sector working with local authority, PCN, around the key information and the vaccination rollout, and just thinking about where we've been able to distribute the grants as well, around the key messages and that work. So just to let people know, so those that might not be aware, we had some public health money that was available to communities of interest, and it started off with the young people, older people, then we worked with faith communities, culturally diverse, men's, and then learning disabilities and autism. And that was around some capacity funding, which was £1,500 to be able to either fund volunteer expenses or pay staff to deliver certain projects. And that was around the key COVID-19 public health messages. We paused those a few weeks ago, but recognising that we need something more, and it's around the vaccine. How do we reach those really small communities and support them, whether it be financially, with resources? So just to let you know that there is quite a bit of work going on around that, and what we're doing is we're mapping where there is maybe vaccine hesitancy, low uptake within PCNs, to see where we can target and focus that funding support for the organisations working in that area. So just to kind of give you a bit of an overview. And I was going to leave it till the end, but I'll do it now just because I've got the floor before we go into the check-ins. So just to let you know that a project that we're working on is the Community Champions project. People probably have heard the Community Champions and the volunteer workforce that we've got across the city. This is something a little bit different, and what that is, it's a partnership between Leeds City Council. They've got some funding from Sophie, help me out, MH, is it the Ministry of Housing, essentially?
I think so, yeah. I knew you were going to ask me.
Yeah. So that's going to be a partnership between Leeds City Council, Voluntary Action Leeds, Hamara and Forum Central. And that will be, it's recognising that there is a volunteer workforce already within, you know, lots of different organisations, and who are already working in communities, in food banks, delivering that befriending, doing shopping, walking dogs, whatever it is that they're doing. But what this project aims is to offer that additional support. So it will be some training around positive conversations to do with the vaccine. There'll be extra support through Val, Hamara and Forum Central to be able to get access to those resources as well. And there is going to be some grant funding for some small projects as well. But it's essentially, how do we then not necessarily recruit new volunteers, because we know that we don't really need to do that. We know that there's a great force across the city, but how do we then give them more training, skills, knowledge, confidence to have those positive conversations around the vaccine? So we're just still ironing out the last few items really around what training and what we feel that people might need, and hopefully next week we'll have something to be able to share further. But it's just to give you a bit of a heads up that we'll be promoting that from next week. Have I missed anything on that, Sophie? No, thank you. So shall we go into check-ins? What's happening within your community? Caroline, I don't think I've met you before. You sat there ever so patiently. Where are you from?
Hello there. I'm from the involvement team at Leeds CCG. I'm coming because Chris Bridle couldn't come today. So I mean, the things that I've been asked to sort of forward, I think you've covered lots of the things that I've been asked to sort of mention. So like, you know, the pop-up vaccination stuff with the Bilal Centre and the minibuses. And I know one of the questions that you sort of picked up on about, you know, how do we book onto the minibus sort of vaccine? How's that going to work? So, I mean, any questions, do forward them on to Caroline Mackay. So I will ask her that. Also to mention that the CCG are doing another Facebook Live session on the 25th of March for sort of questions and answers surrounding the vaccine. And then just a reminder as well that the CCG is sort of like the website is a central place for all these sort of up-to-date advice with regards to the vaccine, which I can post some links on the chat.
We've got them already, Caroline, links from Caroline Mackay. So
perfect. So yeah, and I think that's my update really. And then I mean, Caroline's obviously involved with the vaccine champions as well, which seems to be a really exciting sort of rapidly evolving project really. So but yeah, I think that's about the updates from me.
Fabulous, thank you. Sarah Wilson, do you want to give an update?
Yes, hello everyone. I'll try and make it more concise and shorter than last time, because I know that was a lot of information. Key stuff for me, I suppose, is that burnout and staff wellbeing is still a huge issue across the board. And I'd encourage anyone that's available to go to the Mindful Employer Conference, which is running all 5 days next week, and includes loads of best practice from people across different employment sectors, but great examples from the third sector, including Alison Lowe and Touchstone, in terms of working policies and practices that they have to ensure staff wellbeing. So I'd highly recommend it. It's absolutely free. You just have to sign up to the Mindful Employer Charter, which again is just a free thing that you sign up to as an organisation. So that's next week. I can send the info through, Stacey. There's anxiety about aiding transition, particularly for people with OCD or agoraphobia or things that have been significantly worsened by the crisis or trauma as well, and just work being done to try to think collectively about how we address those issues. There's also work going on even around unemployment, and some kind of cliff edges have been identified. So firstly, the coronavirus eviction ban on the 31st of March and the repercussions of that, the end of the furlough scheme at the end of September, and generally the potential surge in redundancies, or as we've kind of seen in the news with Evans Cycles, contracts changing or a shift towards 0-hour contract, and the impacts on mental health. So in terms of what's kind of new from 2 weeks ago, I'd say those are some of the things I've been focusing on the last 2 weeks.
Thanks, Sarah. Jen, are you all right to go next?
Yes, I am. Yeah, nothing much to add really. We're starting to think about the organisational response in terms of coming out of lockdown, and as was just said by Sarah, staff wellbeing and mental health remains a key priority of the organisation. I think in terms of the actual client groups, that's quite steady, some of which have taken up on the vaccine, some of them haven't, but it's pretty much status quo as it has been.
That's great, thank you. Emily, are you all right to go next?
Yeah, sure. Hi, everybody. Just in case you don't know me, I work for Women's Lives Leeds, coordinating the movement for Leeds to become the first UK women-friendly city. Just you mentioned about training, and I know I've just said that I'm doing the training to be a volunteer vaccinator. The St John's Ambulance training around messaging for how the vaccine works and how safe it is and why it's safe is really good. I've learned so much about how definitely the way that the kind of vaccine works is safe. I've never had that kind of messaging through other means, which is interesting because we're saying a lot about how the messaging should be really clear, but I found out much more through that, unfortunately, than I have through the vaccination messaging. It's really good. Anyway, just as you were mentioning training. I think the top thing for us at the moment that's cropping up is around maternity and breastfeeding, particularly, and the vaccine. In terms of maternity, that's a really tricky one because obviously they weren't able to do any of the trials in pregnant women, so that's why they can't say for certain, even though it looks like it would be very safe. So pregnant women are waiting until they've stopped being pregnant before they have the vaccine. But with breastfeeding, there was a bit of confusion because I think initially it was said that breastfeeding women should not have the vaccine, and now the information has changed. As far as I understand it, all the information is different. And the fact that I can't really understand it very well is potentially a problem. But I'm trying to kind of collate a lot of the information at the moment so that we can put out a blog post in partnership with the MPV and the breastfeeding team as well, just to kind of get the clearer information. But when you look at it, when you do look at the information that's available, Shaq provided me with some great information from the communications team, really good. But it's quite sparing. And I think if I was reading it, I'd be left a little bit like, and so putting something together for that would be good. And I'm sort of looking to do that, but I don't know, there is specific information out there, but there's quite a lot. And then when I shared it with people, they were saying, oh, and what about this and what about this? So potentially not as easily accessible. Sorry, I'm really like blurring all my words today. I've had a full-on day. So yeah, I think that's enough from me. I think I'll shut up there. Thanks.
Oh, it's fine, Emily. And you are quite connected in with Shaq and Natasha and Caroline in a way, aren't you, for that support around that messaging?
Yeah, I think Shaq's left or leaving, but he gave, is that right? Yeah, he gave me some brilliant information, but it's like, I think it's difficult because the information coming from higher up from the government was a bit confusing around breastfeeding. Caroline, maybe you can help me out with this one a little bit.
I will try. I am relatively new to the team. Back to Caroline, other Caroline, and see, what other sort of information we can get, or Natasha. Definitely, there is an interim person replacing Shaq, but Natasha might be your best.
I think Natasha is the person that Shaq has said in his last email to me. I think he said, "I'm going soon, but please speak to Natasha." I'm sure it's her.
Yeah, she's very good and she's very on top of all the vaccine stuff. So
when the other vaccine information for other groups is really very clear, but and the whole issue is because you can't test that demographic, pregnant women, you can't. So that's why it's really difficult. But the breastfeeding stuff in particular has changed from you can't have the vaccination if you're breastfeeding to yes you can have it. So that's the bit that's a bit all over the shop, I suppose.
Yeah, I agree.
Yeah, and I think probably Natasha behind Shaq's scenes in a way. So Stu, Healthwatch.
Yeah, hi everyone, I'm Stuart from Healthwatch Leeds. Kind of interestingly, following up from what Emily said, we've been picking up a little bit recently around potential vaccine hesitancy amongst the healthy population, in particular with regards to concerns around fertility. as well. So we're going to look into that in a little bit more detail over the next few weeks and see if we can pick up more kind of evidence around that as well. But it's not really an area we'd thought about because there's been a lot of concentration on specific communities and not the population as a whole. So it'll be interesting to see what comes from that. I just wanted to give a big thanks to a lot of the people in this group. We've just finished off our draft health inequalities report. So thanks for those that have contributed. We will be adding more to it. So if you haven't and you want to contribute, please do. It's going to the Partnership Executive Group this week or early next week, and I'll be able to share it with you after that. Really interesting stuff. So we've kind of picked the top 10 actions for the Leeds health and care system to address, but in amongst that as well, we've got the specifics from each community as well. I'll just run through the things that we picked out, and I don't think there'll be anything new or that you didn't know anyway. So they were like the key role of the GPs, people's front of house experience, accessible health and care services, joined up health and care services, the impact of poverty on accessing services, digital inclusion, the importance of having an inclusive workforce who are maybe trained in that person-centered working practices. And then there were particular gaps and improvements in current service offers. For example, what was it? Extended appointment hours. I can't remember the others. Like seeing the same GP and mental health and culturally appropriate language. I think there were some of the things that we picked up. Then the other couple were partnerships with trusted community organisations and doing all this with people and communities. So this has gone to the health inequalities and is going to PEG. And I think there's a real, the initial draft was really well received and they think they can work with these 10 actions. So I'll keep you informed about progress on this as well. And I'll share it next week with you. Another thing we're hearing, and we've been hearing constantly now, is around dentistry. And it's because it's commissioned by NHS England on a regional level, it's not really been touched, I don't think, at a local level. It's getting to the point where it's crisis, I think, in Leeds, and it's affecting not only people's dental hygiene, but it's affecting their general health and well-being. And this could be condition specific around maybe diabetes and in particular mental health as well, and the impact this is having on people. And also there's a massive potential health inequality here because people are being either forced to go private or have no treatment at all, because like the quickest waiting list is probably 12 months. So if you haven't got one, or even if you have got one, they're not really seeing you at the moment as well. So we're collecting as much evidence as we can. So if you have any for yourselves, your families, or particular communities, please share it with us. I'm meeting with NHS England next week, one of their dental commissioners, and we're taking it to the West Yorkshire, let me try and get this right, System and Oversight Assurance Group or something like that, to up on a regional level, because we're getting that feedback from other regional health watch as well. Yeah, so that's one thing I wanted to pick up on. And the last thing really was our next check-in is going to be around pause treatment and waiting lists and how this is impacting on people and where. We're getting quite a lot of inquiries through about the impact on people's health because their operation or appointments have been delayed because of COVID and the impact. So we just want to get a bit more information around the impact this is having on people. So I'll send this out via communities of interest, and if you can share, that'd be brilliant. That's all from me.
That's great, Stu, thank you. And I'm glad you raised that about the dental, because Zyra from Forum Central, she's sent something across as well to raise that, just the difficulties finding NHS dentists that will take new patients. But just to kind of pick up on that, I rang my dentist for a checkup and clean and polish, and they couldn't fit me in, but yet I could go to a dentist in Garforth and pay private to have that treatment done. After I'd done that, I then saw on the Facebook account, my dentist was actually offering that treatment if people paid, and I was just really, really confused. So you can't get me in for this, but you can charge other people to do it. Yeah.
So one of the things I'm kind of pushing for, because I don't think we're going to be able to change the way things are at the moment. They're on reduced capacity because of COVID in some of the practices they can do, but there's not clear information out there for people. And at least if you get that right, people aren't phoning around and around and around. The NHS dentists don't keep the website up to date. They're not following the SOPs, the standard operating procedures set out by the NHS. We know that already, and we're feeding back to NHS on that. So there needs to be, I don't know, whether it's clear information around what the process is, because you can get emergency treatment, but there's quite a strict kind of criteria for that. But I think people just need to know what that criteria is and where they can go, so they're not phoning 40 or 50 dentists in a day, because that's what's happening. Oh, sorry.
Yeah. No, that's fine. That's fine.
I want to share my experience as well, because with the dentist, it was awful when I was trying to find at the British Red Cross for a client. I called around 20 clinics and nobody was getting any NHS patients. And, you know, for me, maybe it's not the end of the world, but I was talking about some refugees family that really, really need help and they couldn't get access to it. So there is lots of confusion and uncertainty now that affects people a lot.
You don't want to share any of this with me or via Stacey, because I really do need to collate this as well.
Yeah, I mean, I can.
I'll put my email address in.
Yeah. No worries.
Yeah.
Thank you.
Owen, are you all right to go next? And you've got your hand up.
Yeah. I mean, put my hand up and say I had to have a tooth pulled out in like kind of June or something, and it is a case of like the emergency dental treatment is a case that you can ring up 111, and there was some guidance that I've followed on the NHS website, and I know a colleague of mine yesterday went to the place in Sheepscar, the kind of emergency dental one. So I guess I know that's not addressing the whole issue, but I guess just for information, really, that's where it's being triaged in terms of. I know you said there's that criteria, Stuart, but I guess if you're directing people who need emergency treatment, that seems to be. But even then, yeah, there's issues.
Which is funny because the NHS England, the standard operating procedure is to contact your dentist. They will triage you and then refer you for emergency treatment. They didn't recommend phoning 111, even though you can go down that route. So this is where there's mixed messages as well.
Yeah, that seems to be the answer, you know, is to ring 111, and they take information off you, and then people who are in like really dire need. I mean, even then, I think there's a waiting list and a delay if you need treatment other than your tooth being pulled out. I think I think they're fairly brutal, but you know, I know even, you know, there's massive. There was with my colleague, there was massive gaps in being told, oh, we'll book you on to this thing in 6 months' time, and then rang up and went, oh no, we forgot to book you on. So the system's obviously creaking massively, but it's dangerous times. But is it privatization by stealth? Don't know.
I think that might be a conversation for another meeting.
I wasn't getting too political there, was I? Like that's
No.
You're allowed to criticise the government, I think.
Well, you've got the floor, Owen.
All right, okay. So I mean, we have started we've been doing some work with Leeds Teaching Hospitals Trust around like getting reasonable adjustments in place for autistic people, and Alison Conyers from there has done really amazing work getting kind of Thackeray and Ellen Road sites kind of equipped and trained to offer people those reasonable adjustments. In addition to that, hopefully by Friday we'll have a kind of, not alert card, but a kind of A4 PDF type thing that's quite generic for people to list what reasonable adjustments they can ask for when they're going, but to kind of like book ahead basically to get those reasonable adjustments requested. And I guess the picture amongst GPs it differs, doesn't it, depending on the practice, but you know, like that resource is primarily kind of hopefully going to be used by people getting the vaccine at their GP surgery. I think we're slightly behind. I think I mentioned before that most people in their kind of 50s, 60s, 70s, 80s probably wouldn't have a diagnosis. So we most likely lagging behind. I know I need to follow up an email. I've got it in draft form around trying to argue that, you know, for various reasons, autistic people should be kind of added to the priority list. So I'll send that after this meeting. In those terms, we were also probably a bit optimistically in like September last year, did a kind of like COVID recovery plan, you know, in terms of like getting back to normal and addressing various things. And I think like, you know, that's aimed at autistic people who have fluctuating functionality for various reasons. What we did do was to kind of say, you know, help people write down everything that they need to get done, whether or not that's getting back into education, getting a job, or health issues, and to try and prioritize that, but also like recognize that people's, I don't know who's aware of spoon theory, but like, you know, like how much emotional energy somebody's got to expend in doing these things. So I don't know if that would tie into anything else that anybody else has done in that planning, and is interested in what you were saying, Sarah, around that. Like agoraphobia is a big issue in the autistic population, and you know, kind of be interesting to be involved in that kind of like self-recovery planning. Otherwise, I won't go into the details, but we're doing various kind of like health inequalities work, and one starting with a local care partnership, a group of GPs in May, that'll hopefully kind of look to address these things in the wider long-term sense. But yeah, I'll leave it there.
Simon, are you all right to go next?
Yeah, I mean, I was going to mention the Bilal Centre and Places of Worship as vaccination centres. Obviously, that's already been mentioned. Just on the subject of getting faith community uptake on vaccines, I was contacted by, I think it's the communications lead from the NHS Clinical Commissioning Group, who's putting together some videos from faith leaders. I mean, I know that faith leaders have done an awful lot already, and certainly Carrie Aston, for example, has done a phenomenal amount of work. But this is gonna pull together a range of community leaders to talk about the importance of vaccinations. I don't know when the video is going to be made. I think just in the process of getting volunteers, really. That's the first thing. Second thing, just to flag up, is that obviously we've now done pretty much a 1-year cycle of faiths in lockdown, if you like, with key festivals being celebrated. And it's really just to flag up that obviously in the next month or so, we've got Easter, Passover, Ramadan and Vaisakhi. Possibly there might be other faith festivals as well. And I think it's really just to hope that all the fantastic work that's taken place in Leeds and all the fantastic work in faith communities continues, despite the fact that obviously the real temptation to celebrate these festivals. So you know, I just hope we can get through those periods. The only other thing to mention is from Leeds Faith Forum perspective, which is our the link organisation on this group, we're just finalising our strategic plan, which I'd be happy to share with the whole group once it's done. We're just in the process of just getting feedback from some of the board members, and that has been revised several times to take into account COVID. When it was originally written, it was before last March, so we've had to revise it various times. So it might be that when people read it, the stuff they want to collaborate on.
Thank you, Simon. Thank you. Sophie, did we hear from you? No.
No, you didn't. I'm going to say sorry to Stu as well, because I've just seen the email about the reporting inequalities this morning, so it's on my to-do list now, Stu, because there's a lot of things we'd want to comment on. And interestingly enough, our patient ambassadors have been commenting on dentistry problems being an issue, I think October, when they were starting to work with the clients again. So yeah, I think it's important, so we've got stuff to feedback. We're just vaccination mad like the rest of everybody else, really. We've had our PAs have been supporting in the East over at Bilal Centre today, but before that they've been at East Park Medical Practice, and then in South they're at Lingwell and Beeston Hill, just supporting people, kind of again that third sector squishiness to sort of put people's mind at ease when they're going in. We've arranged a Q&A session with a local doctor, and we're going to be doing another one for our members. And yeah, everything else is kind of just geared around just keeping our members supported online. The food bank at the minute is kind of our big issue, because a lot of suppliers are saying that their supplies are slowing down, and so therefore ours now, our donations are as well. So it kind of feels like with this roadmap out of Britain that's happening quite quick, and again, without making it too political a conversation, it's kind of aimed at one group of people as the roadmap out of Britain, that there's all these other communities that actually are still going to be struggling way after June 21st. But already we can see a bit of a dip in things like supplies and for example, volunteers who have all gone back to work full time, etc. So yeah, our main focus at the minute is just making sure that all of the communities that we support through his food bank, etc., are going to be kind of supported to you know, moving on from this. I think that's probably all I've got to add. Luckily, Stacey did our community champions update. Thank you, Stacey.
You're welcome. Sam tried to ring me before, but I already on the radar. I thought perfect opportunity. Jag, I know you spoke earlier, but have you got anything to add?
No, just to say we're busy with the transport strategy refresh. So that's a big piece of work. We're working in March to get people's views together. So we're going to be discussing that next week at the community forum. We're going to be discussing that at the Access Usability Group that I chair on Monday as well as a topic. It'll be nice to get people's views on that. We've also got the Deaf Forum tomorrow, where we're talking about myth busting COVID. We've got a GP from Leeds Teaching Hospital Trust and Dr. Satar attending, and that's with deaf communities in Leeds and Barnsley, the other forum we run. And we can go on, but I think they're the key things to mention. We've got those activities coming in the next 2 weeks. The listening project with social care continues. That is something I want to bring up at some point and talk to all our members about. We need everybody on board on that one, because that for us is about how do we work to make sure people that don't access social care, and there's a track history of not attending social care, how do we engage with them, particularly from African, Mediterranean communities, Caribbean communities that are overrepresented, also about how do we work with Pakistani, Indian and Chinese communities, Vietnamese communities. They're not coming forward to access social care. So the director and the team have taken that work on board. And I know Forum Central are going to be working with the third sector to get your voices into that. So it's really exciting. So we're hopefully going to be looking at people coming out to Hamara, to Forum Central, to other places, yourselves, trying to do a peer support session on consultation. And that'll be April, May, where we look at that. And it's in view of trying to address the inadequacies of the system historically and how we can all work better. It's on the back of Black Lives Matter. It's more importantly, it's been an ambition, I think, of the council that they recognise that social care, it needs to do a bit more, and how can they do it? So it's really exciting work, but it's a lot to do. Thank you.
Yeah, thanks, Jag. Zoe, hello, have you got anything to feed in?
Hi, well, I fed into the Health Watch Health Inequalities draft report, so there's quite a lot in that covering how older people have been affected, but I suppose I could just highlight a few points, which is obviously social isolation and loneliness was a huge issue before the pandemic, which has just been compounded hugely, and particularly for those living on their own and older men. And there's a huge report of the low mood and fed upness that it's just increased hugely recently. I mean, it was always there, but it's very, very much more noticeable at the moment. We're also hearing bereavement and grief has been had a huge impact, not just perhaps those that have lost loved ones during the last year, but sort of bringing back emotions from previous bereavements due to the sort of circumstances and how people are not able to perhaps have contact with others. There's a lot of anxiety and panic attacks being reported, and mental health issues from people who have never previously had any mental health issues. We've also heard from Age UK an increase in domestic abuse and substance abuse. So sort of there's a lot of low self-esteem due to being called vulnerable for the past 12 months. So really looking forward, we're sort of working with the Bronze Older People's Group to look at reset and recovery, they're calling it, but sort of how we can support older people, knowing how these things have impacted over the last year, and doing our best to be supportive. But a lot of third sector organisations are reporting that whilst there was an emergency response, actually knowing what's coming is quite exhausting to look forward. I think bearing in mind all the energies that have been spent in the last year, there is a bit of exhaustion in the system, and sort of looking forward and thinking how are we going to deal with this, and also there's a big disparity between people that are very keen to come out and get back into things and people that will need huge amounts of support to do that, and actually how you support those polar opposites almost. So yeah, and a bit about vaccination messaging being confusing. We had some reports that some older people stopped taking their other medication, and there was concerns that because the second vaccination was delayed, that was quite worrying, and I think the messaging perhaps wasn't clear around why the dates were changed, and then Time to Shine is looking at strength and balance, because there's been a huge amount of deconditioning in mental health and physical health over the last year for a lot of older people. So that's going to be a focus next year. So that's a bit of a roundup of what I've heard sort of recently, which might be useful to share.
Yeah, definitely. Thanks, Zoe. Just kind of hearing back from what older people are saying, and that physical and that frailty, and how we then get people to become more mobile, and been telling people for the last 12 months, stay in, how that's a massive amount of time to then say, right, come on everybody, let's get out. And I know my neighbour, he's 70, and he hates it when people call him older or vulnerable. He gets really, really frustrated around it, because he's really fit, he's really healthy. And I know when there's been all this, look out for your neighbour campaign, it's not always about younger people looking after older ones. When me and my husband were both at work, they used to put his bins out, he would cut my hedge, he'd bring the bins in. You know, it was all one-sided where they really looked after us. So it's just, yeah, massive, massive. So, are they old houses?
One more point, sorry, I forgot. Yeah. When we were talking about dentistry, it's just something I've come across a bit before, is I know dental care and Alzheimer's and dementia have quite a big link. So I don't know if that's something, you know, we need to, knowing that dental care is there's a huge gap there. I'm just wondering if that's something of note. Perhaps it's not an area, obviously, that I have specialty in, but it sort of, having worked with people living with dementia, I know there is a link there, and I suppose it might be worth us flagging up. Is that something we should be thinking about?
Mm-hmm. Okay, yeah. Our chair, John Bill, he's part of the Dental Commission Executive. I can find out some information about it, no problem. Yeah,
it might be just something to monitor, I guess, with this unusual situation we're in, and what's happening.
Yeah, right, okay. Has everybody had their check-in, being able to feedback? I've not missed anyone, have I?
Stacey, sorry, I'm just thinking, like, now that we're talking about dental stuff, I wonder whether it's also worth thinking about women in dental, because I know that during pregnancy, women get free dental care because they're at higher risk of dental issues. And I don't know, and I've not heard anything, but it might be interesting to find out whether they've still been having that free dental care during their pregnancy.
We've been hearing loads from people pregnant, and they're having the same trouble. They're not getting any preferential treatment.
Okay. Yeah. Thanks. Sorry to butt in. I just
we are flagging those up as well.
No, not at all, Emily. I think today's session, we've really been able to, just because we've not had a guest speaker in and there's not that many people, it's just been really different and nice to be able to, it's not just about us giving you lots of information and you giving us, we've been able to have those conversations as well, which has been really great today. Has anyone got any other business, anything else that they would like to comment or share? Sarah?
Sorry, just one quick thing. In April, I'm going to be running a wider reference group that's going to fit into the Mental Health Collaborative, which is a collection of professionals that are all focusing around access to crisis services. And if anyone would like to be a part of that reference group, it's basically for services who aren't crisis services, but they refer to people in crisis and might have a lot to contribute in terms of what improvements to access to crisis might look like. Please get in touch with me. I'll put my email again in the chat, but you're all more than welcome to attend.
Can you just summarise that in a sentence as well, Sarah, and then we can share it with the weekly email? Brilliant. Right then, so 20 minutes early, everybody. After a long day of meetings, and equally everybody else, thank you everybody for your time and effort, and enjoy the rest of your day.